Hey everyone, in today's video I'm going to talk about hip impingement, or FAI, so femoral acetabular impingement. So a lot of my patients that I see come with feeling a very strong pinching or pulling sensation in the front of their hip when they're doing specific exercises. So as an example, sometimes people feel when they lay on their back, when they bring their knee to their chest, they feel a pinching sensation in the front of their hip. Or if I kind of pull this knee to the opposite shoulder, this direction, they also feel more of a pinch. Another example of when someone might feel the pinching feeling is when they are in child's pose and they feel pinching again in the front of the hip. So this is known as hip impingement, and it's very common in a lot of my clients. A lot of people tend to think that because the pain and pinching is in front of the hip, I need to focus on treating the front muscles of the hip, like your hip flexors, your iliacus, your psoas muscles, your quads, because it's tight here. But oftentimes I notice that the problem with hip impingement is actually rooted in the back of the pelvis. In other words, your glutes and your pelvic alignment or your pelvic orientation. So I'll say that again, is that hip impingement is commonly felt in the front of the hip, but the root cause of the issue may actually be the back of the pelvis or the glutes. So if you've been doing a lot of stretching in the front of your pelvis, you've been doing all the hip flexor releases as possible with the ball, you've been stretching out your hip flexors, you've been massaging that, you've been foam rolling it, and you're not really noticing a difference, it could be because you're just temporarily kind of relieving the tightness there and you're not really fixing the root cause of the issue. So why is this happening? Why does hip impingement happen? So your hip is a three-dimensional joint. Now, I'll kind of show you when I'm laying on my back because it's a little bit easier to demonstrate. But as I'm bringing my hip up, your hip bone needs to glide posteriorly, sinking back into the glutes so you can bring your hip forward. If your glutes in the back are tight, it's going to shove this hip up and forward, and it's going to hit your hip flexors. So as I'm bringing my leg up, it's going to be gliding up, it's going to be shifting posteriorly so it's not pinching. If this hip bone is not allowed to glide back into the glutes, it's just going to keep shoving forward, and it's going to shove into my hip flexor. So I'll kind of review that again. So again, if your glutes are tight here, let's say your piriformis, your deep hip rotator, all these good muscles in the back, if they are tight, they are going to it's not going to allow your hip or your femur bone to sink back as you bend your hip. Instead, it's going to shove it forward and it's going to hit a different structure, your hip flexor. So what I find that's really important is actually releasing tension in the back of the pelvis so that your hips can sit back into the socket so it doesn't impinge in front. So what causes tightness in the back of the glute? So the muscles I'm particularly talking about are your hip external rotators. So think about the muscles that do this motion, that do external rotation. So another way of thinking about it is muscles that do this motion, external rotation, external rotation. Because when you externally rotate, it creates a lot of tension and tightness and shortness of the muscles in the back, which is not necessarily bad. We need that as too. But if it's too much, it's not going to allow your hips to sink back into your glutes. It's going to push it forward. So what causes those muscles to get tight? Well, if you are walking and you tend to toe out a lot, that could also cause a lot of shortness in the back. If you sit like this all day, like on your computer or when you're playing with your kids, again, this is hip external rotation. It's naturally going to shorten your muscles. If you are at your computer and let's say you are working all day and you are sitting in this position, or you tend to do this a lot, again, one hip is an external rotation. So external rotation isn't bad. It's just that if you aren't diversifying your rotation movements, like if you aren't doing or equalizing with hip internal rotation, which is this motion, then you're just going to get a lot of shortness and tightness in the back of your glute. Another cause of tightness in the back of the pelvis could be if you tend to tuck a lot or be in a posterior pelvic tilt. So instead of like a nice neutral spine, you are a little bit more tucked under. So those are different reasons why you may have tightness in your glutes. And like I said before, hip external rotation isn't necessarily bad. It's just when we are doing it excessively and repetitively without any diversity in our movements. So our body needs to be able to go into both external rotation and internal rotation to have happy and functional glutes. If we do too much of the external rotation, then it creates a lot of shortness and stiffness and tightness in the back of the pelvis, and that can lead to a lot of hip impingement issues. So by opening up the glutes, by lengthening the back of the butt and creating space in the back of the pelvis, you are going to naturally allow your femoral head or your hip bone to sink back into those glutes so it's not impinging in the front. There are different exercises you can do to help release tension in the back. I will link below a video in regards to how to use a lacrosse ball or what we call an orange Franklin ball to help release tension in the glutes. That is a really helpful technique, and I also will link down different stretches that you can do to help release tension in the butt. So I hope that video was a good explanation. Again, if you notice that releasing the hip flexors is really helpful, again, that's great, but I would try to supplement it with something else to try to fix the root cause of the issue, if in particular the tightness in the hip flexors is not the only reason for your pain. So if you have any questions, please feel free to leave a comment below.